If you want to learn everything you need to know as a nurse about hydrocephalus, then this is the video for you. And before we get into this video, watch my short video on cerebrospinal fluid, linked on screen and in my bio, if you need a refresher on anatomy and physiology. Hydrocephalus is a disease in which there is an abnormal accumulation of cerebrospinal fluid. It can be congenital, meaning present from birth, or acquired. Cerebrospinal fluid accumulation is due to a mismatch between its secretion and absorption. There are two main types of hydrocephalus, and they are categorized by their underlying cause. Communicating hydrocephalus is caused by an obstruction to the flow of cerebrospinal fluid outside of the ventricular system, or a problem with its reabsorption. Whereas non-communicating hydrocephalus is caused by an obstruction to the flow of cerebrospinal fluid within the ventricular system. Common causes of communicating hydrocephalus include bacterial meningitis, subarachnoid hemorrhage, head injury, alteration to the choroid plexus or arachnoid villi, or spina bifida. Common causes of non-communicating hydrocephalus include tumor, cyst, stenosis, abscess, or hemorrhage within the ventricular system. As fluid accumulates within the central nervous system, intracranial pressure increases. The ventricles become enlarged and surrounding brain structures become compressed. This results in damage and atrophy to the brain. If left untreated, intracranial pressure will continue to rise until brainstem herniation and death occur. This is also known as coning. Signs and symptoms of hydrocephalus in an infant include increased head circumference, which is a cardinal sign. This occurs because an infant's skull bones are unfused until about 2 years of age. Additionally, infants will typically also present with bulging fontanelles, which are the soft spots on a baby's head, and separation of the bony sutures, which are the spaces between the various skull bones. Infants may also present with scalp vein distension, sunset eyes, a shrill, high-pitched cry, difficulty feeding, vomiting, lethargy or irritability, hyperactive reflexes, bradycardia, increasing temperature, hypertension, and respiratory depression. Signs and symptoms of hydrocephalus in an adult includes motor and intellectual disability, decreased level of consciousness, change in personality, headache, papilledema, which is edema of the optic nerve, vision problems, vomiting, bradycardia, and hypertension. Diagnosis of hydrocephalus in infants includes an ultrasound, which can detect the disease in utero, measurement of head circumference, which will be larger than normal, transillumination, which involves shining a light at an infant's head to visualize fluid accumulation in the tissue, and X-ray to visualize separation of the skull bones. Diagnosis of hydrocephalus in adults includes neurological exam, CT or MRI, which can discover enlarged ventricles, and a fundoscopy exam, which visualizes the optic nerve for papilla edema. Treatment of hydrocephalus is aimed at controlling cerebrospinal fluid volume. Treatment of the underlying cause, along with the surgical placement of a shunt to control cerebrospinal fluid volume, may be required. A shunt drains cerebrospinal fluid out, such as a ventriculoperitoneal shunt, which drains cerebrospinal fluid into the peritoneal cavity, or a ventriculoatrial shunt, which drains cerebrospinal fluid into the right atrium. Another intervention, most appropriate for communicating hydrocephalus, is an endoscopic third ventriculostomy. It is the surgical creation of an opening in the floor of the third ventricle to the basal cisterna. This wraps up the pathophysiology you need to know as a nurse about hydrocephalus. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!